Hello everyone, my name is Kelvin Msendeka, and today we'll be looking on antifungal drugs. Before I go further, let's look on the classification of fungal infections. Fungal infections, they are classified into two types. There is what we call superficial fungal infections and deep fungal infections. Superficial fungal infections, they are caused by dermatophytes or candidas. Examples of infections caused by dermatophytes are tinea pedis, which is a fungal infection of the foot, tinea capitis, which is a fungal infection of the scalp, tinea inguinus, which is a fungal infection of the nails, tinea capitis, which is a fungal infection of the body. And examples of superficial fungal infections caused by candidas, we have infection of the cutaneous, infection of the vaginal, infection of the DIT, and infection of oropharyngeal. Away from the superficial fungal infections, let's look on deep fungal infections. Deep fungal infections, examples that I'll give are, we have pneumonia, we have gastroenteritis, endocarditis, and meningitis. These are examples of deep fungal infections. Away from deep fungal infections, let's look on the classification of antifungal drugs. So antifungal drugs, they are those which are given systemically and those which are given topically. Those which are given systemically, examples I'll give here, amphotericin B, and flucytosine, and azoles. Azoles examples we have ketoconazole, itraconazole, and fluconazole. Let's look on the treatment of superficial fungal infections. So antifungal drugs used in the treatment of superficial fungal infections, they are those which are given systemically and those which are given topically. So I'll start with those which are given systemically. Those which are given systemically, we have examples, and these examples includes, we have glycylfulvin. Glycylfulvin is one of the antifungal drugs we use in the treatment of superficial fungal infections caused by dermatophytes. Another example is terbinafine. Terbinafine is one of the drugs used in the treatment of superficial fungal infections, and it is given systemically, or it can also be given topically. So it depends with the type of formulation. And other examples that I'll talk about, before I go further, terbinafine, it's effective in the treatment of fungal infections caused by dermatophytes. Another example that I'll give are azoles. Azoles, they are effective on both dermatophytes and candidas. Examples, itraconazole, ketoconazole, and fluconazole. These, they are effective in the treatment of both candidas and dermatophytes. Let's look on the antifungal drugs which are used topically. And these drugs, examples includes, we have cystatin. Cystatin is one of the most used drugs. Cystatin is one of the most used drugs. These drugs, they are used in the treatment of fungal infections caused by candidas. Fungal infections caused by candidas, cystatins. Another example that I'll give, which are given topically in the treatment of superficial fungal infections, we have gentian violet. Gentian violet is also effective in the treatment of superficial fungal infections caused by candidas. Another example I'll give is Whitefield ointment. Whitefield ointment is one of the antifungal drugs used in the treatment of superficial fungal infections caused by dermatophytes. Another example that I'll give are azoles. Azoles, they can be applied topically and systemically depending on the type of formulations or the route of administration. Away from azoles, I'll talk. Let's look on the terbinafine. Terbinafine, it can also be given systemically and orally depending on the formulation or the route of administration. And let's look on each type of drugs now. Let's go in detail. I'll start with amphotericin B. Amphotericin B is one of the antifungal drugs used, and it's mostly given via intravenous injection, IV. Amphotericin B, the mechanism of action is that it's bind to egostro on the fungal cell membrane, egostro, which results in the formation of artificial pores in the fungal cell membrane, resulting in the fungal cell death. Amphotericin B is usually combined with flucytosine. So let's look on flucytosine. Flucytosine is one of the antifungal drugs used in the treatment of fungal infection. Flucytosine is a cytotoxic drug. It's converted to 5-fluorouracil, which results in the inhibition of nucleic acid synthesis. So flucytosine, it cannot be given alone. When given alone, it develops resistance. Therefore, it's used in combination with amphotericin B. So the advantage of combining flucytosine and amphotericin B is that it reduces resistance of flucytosine, and amphotericin B is given in small doses to inhibit or to prevent nephrotoxicity associated with amphotericin B. So combination, amphotericin B is given in small doses. Therefore, it reduces the side effects, which is nephrotoxicity. Away from flucytosine, let's look on other type of fungal of antifungal drugs. Let's talk about azoles. Azoles, the mechanism of action of azoles is that it inhibits the synthesis of egostro, which is essential in the synthesis of fungal cell wall. The mechanism of action of azoles is that they inhibit cytochrome P450 isoenzyme, which is responsible in the conversion of lanostro to egostro. Examples of azoles, we have fluconazole, itraconazole, and ketoconazole. Away from azoles, let's look on glycylfulvin. Glycylfulvin is one of the antifungal drugs used. Glycylfulvin inhibits microtube function, which results in the inhibition of nucleic acid synthesis. Away from glycylfulvin, let's look on the other antifungal drugs. Let's look on cystatin. Cystatin, it has the same mechanism of action as amphotericin B. Cystatin is bind to egostro of the cell membrane of fungal cell, which result in the formation of artificial pores, resulting to the cell death. Away from cystatin, let's look on terbinafine. Terbinafine is one of antifungal drugs which binds or which inhibits a squalene hypoxidase enzyme, squalene hypoxidase enzyme, which is essential in the synthesis of cell wall, fungal cell wall. So it inhibits the conversion of squalene to ergosterol. It inhibits the conversion of squalene to ergosterol. Thank you very much. My name is Kelvin Musendeka. I just wanted to share with you on antifungal drugs. May God bless you.